Welcome back to Midday Kentucky, everyone. Well, the American Cancer Society estimates 252,000 invasive breast cancer diagnoses just this year within the United States. A breast cancer diagnosis can leave a woman with many questions about how she might look after her cancer has been cared for. Joining us today is Renee Nimtz from Commonwealth Plastic Surgery, and we're discussing all about breast reconstruction. How are you, my friend?
I am great, thank
Now,
you.
of course, this is Breast Cancer Awareness Month, being the month of October, and we're talking a lot about this, and this is one of the conversations that we wanted to have a chat with, and you sent in some great questions that people ask you. So let's start off. When should someone see a plastic surgeon regarding breast cancer reconstruction?
Well, typically you want to see your oncologist and your general surgeon first. Get a plan so that you know, are we going to have mastectomy, meaning the breast is going to be, breast tissue is going to be removed, or lumpectomy and what. And from that, we can then get a plan for how to reconstruct the breast after the fact.
So it's not the surgeon first. It is not the breast plastic surgeon first.
Right.
It is the other part to begin with.
You want to see us early on in the process, though, because I've learned that only 30% of women who have breast cancer get reconstruction. So there's a huge population that may need some education, because you don't have to do it immediately while you're being treated or right when you've had mastectomy. Let's say you've had it and you're sitting there waiting. Don't wait any longer. You can come in and get that reconstruction.
Interesting.
Yeah.
And something I wanted to say to you, can you have the reconstruction whilst having chemo and radio?
Not radiation. So
Right.
radiation is always our game changer with reconstructive surgery. But chemo, yes. And so we can actually see patients, they can have their mastectomy and start that process of reconstruction with tissue expanders, for example, that same surgery day. So at the same time. So one surgeon would start and then the plastic surgeon would finish.
All right, so with Dr. Jared, how are breasts reconstructed? Where does he start?
So it depends on the woman, it depends on the diagnosis. That's why we want to get you in and educate you early on all these different options. Typically, though, what we see is, a woman can have their own tissue used, like they can have tissue from their belly transferred up to their breast, tissue from the back brought around, but that's not the most popular because it is a longer hospital stay, a lot more, surgery involved. Women often with us choose to do what's called a tissue expander. And so they'll do the mastectomy and then they'll put that expander in so that they can regrow the tissue, a breast mound.
That's on, don't laugh at me when I say this, that's also a conversation on Housewives of Orange County right now. One of the women is actually doing that. Okay, let's bring up these pictures that you sent in to me. Some before and afters. Now this is breast reconstruction, correct?
Yeah, and we have seen this patient from start to finish. So she is one who opted for the tissue expander. So she had mastectomy. She had those expanders. We expand over a series. They come in once a week over a series of months. And then she's seen us all the way through nipple and areola reconstruction, which can be done a variety of ways too. There's tattooing, there's actual, tissue reconstruction.
So with the expanding, when you expand, you end up putting in a implant, is that correct?
At the end. So
at the end.
Expander first, we grow that tissue again, then we put the implant in, and then once they're good with that, often we do a combination of fat transfer too to get that breast shape to really not look like an implant's there and, a nice shape.
Great information. How long does the expander take? The process, is it different for most people?
It typically takes about 3 months. Depends on people's schedules, depends on how they, how much pain they're having. So most people can come once a week and have that expansion done, or once every 2 weeks. But the process can take up to 7 months to a year until we're really where we feel like this looks good.
Well, Renee, as always, you guys give us great information from Commonwealth Plastic Surgery, and they also want to offer anyone sitting at home who's going through this process a little bit of a pamper. You can see that promotion up on the screen now, 50% off any facial or peel. I think that's very kind of you to do that.
Well, we want them
because you need
come
to be
in.
pampered.
Yep.
Don't you agree?
Absolutely.
It's all about you when you're going through cancer as well. We appreciate you coming. If you want to find out any more information about Commonwealth Plastic Surgery, we're going to put all that information up as well. But after the break, everyone, Riptide Productions is talking the do's and don'ts when it goes to time to find that DJ for your wedding. It can go so bad.